The billing with private insurance typically works like this. The visit is done. Within some number of days from that visit, it varies insurance to insurance company, you need to submit the documentation of that visit along with an invoice to receive payment. Hi everyone, my name is Mariam Treystman from the Home Health Consultant, and today we're going to be talking about some elements of working with private insurance. But first, if you like our content, please like, share, and subscribe. So this video is going to be for agency owners and management staff and really anybody who is wondering how to work with private insurance companies. Maybe you've had some experience working with Medicare and now you're looking to venture out to private insurances. Before we start, I would like to say that if you are able to, as a home health agency owner, you should start working your company with Medicare. The reason that I think people should start working with Medicare and then move into private insurance versus start working with private insurance and then moving into Medicare is because with private insurance, there's a lot of very strict and short deadlines, whereas with Medicare, you have a little bit more time. It's not that you have more time in terms of doing the things, but you have more time in terms of getting your paperwork together and things like that. So we're just going to get into some of these details, and we're going to kind of talk about the differences of private insurance and Medicare and how to just kind of like the 4 big identifying factors of working with private insurance. And lastly, this is going to be a general overview. Typically, these 4 elements are going to apply to most, if not all, private insurance companies. However, it is general because every company is going to have their processes a little bit different, from just company to company. So this is going to be a very general conversation. So first and foremost, you want to think about the contracting with private insurance. So when you're working with Medicare, there's no in and out of network kind of reimbursement. You're either in Medicare, you either have a provider number with Medicare, you've gone through their enrollment process and you've been approved, and now you can bill, or you can't. It's not that you can take Medicare patients, bill them, but you'll get paid less. With private insurance, you can work with private insurance companies. You're just going to be paid a little bit less. So there's in-network rates and there's out-of-network rates. So when you're in-network, meaning you have enrolled into their system, just like we enroll into Medicare, we're going to enroll into their system. If you have contracted with a private insurance and now you're in network, you're just generally going to have higher rates. When you're out of network, you're going to have lower rates. The difference between the rates, that's going to vary company to company. And one more interesting thing, the rates are negotiable. That might not be true for every single company, but you do have some kind of negotiation power, whether you're in or out of network. There is not much leverage in the negotiation, though, for agencies, because typically the insurance will have more people wanting to work with the insurance than your ability to get insurances. So really the insurance company has the leverage in this scenario, but there is a concept of negotiation, whereas with Medicare, there isn't, or Medicaid or Medi-Cal, whatever. There's no negotiating with government rates, but some private insurance companies, you will be able to negotiate. So make sure you ask about that. Next, there's an authorization process. With Medicare, your company is going to be responsible for the gatekeeping and of the eligibility process. And then later there are ADRs in place that will request documentation and review your ability to take patients who are eligible. With private insurance, that stuff doesn't exist. You are going to go through an authorization process, meaning the insurance has to allow you the visit before you could do the visit. If you do any visits that are outside of any kind of authorization you have, you just will not be paid whether that person needed it or not. The reason for this differentiation is Medicare wants to maintain access to care. And access to care is limited sometimes if you have to go through an authorization process that might take some time. Sometimes patients just need like immediate services. Like if you're being discharged from the hospital and you need, like I'm leaving at 4 p.m. and I need IV at 9 p.m. There's no time, and it's Friday night. Like all discharges, of course, happen Friday night for some reason. Like there's no time to go through this authorization process where someone has to review it and tell me it's okay or whatever. And so Medicare wants to maintain access to care, and they do this by making the agency kind of the gatekeeper of the authorization process. So you're empowered to take patients based on your own understanding of Medicare eligibility, but they will review at some point through the ADR process, and they will recoup based on kind of like improper judgment of Medicare eligibility. The authorization process works a little bit differently. Usually, if you're in network with an insurance, sometimes they will be referring to agencies. So if the authorization process works a little bit differently depending on how you get the patient from the private insurance. Some private insurances will be the ones that are referring the patient to you. In that case, they will send the patient with some number of visits pre-authorized, usually 1, 2, 3, like some low number of visits pre-authorized, maybe up to like 5 max, depending on the situation. But really what they're looking for is that you send your clinicians for an evaluation and then submit documentation, and then they can then authorize further visits. In home health and hospice with Medicare, it's a little bit different, right? Like pretty much you take the patient, you are the one that's like deciding if they're eligible or not. And then you're the one, not you, but like along with the doctor, of course, working in tandem with the doctor, you together are deciding how many visits are needed. With the private insurance workflow, there's a third person in this scenario. And so the third person is the private insurance, but they're in charge. It's not you, it's not the doctor. They are very much in charge. So the idea is if the private insurance is referring to you, they're going to give you some number of visits that you could do at the beginning, usually like an eval, maybe another follow-up at that point. And then you need to submit documentation to get more visits. You might request, for example, at that point, 10 more visits, and you'll be given like 5 more visits. Because private insurances are private, meaning they are for profit usually, or, you know, I'm not sure what their like structures are, but like I'm pretty sure they're for profit. They are not looking to give you like unlimited numbers of visits to pay out. So they are always going to approve you on the minimum. Another way of getting referrals with private insurance is the regular way. You get a doctor refers a patient, or, any kind of like referring entity, right? Like a hospital, whatever, wherever you get your referrals. They'll refer the patient, and now you have to kind of like fight for your authorization process. So the authorization process is a bit of a push and pull, meaning they want to give you the minimum. They're like a bad boyfriend, okay? So like they want to do like the bare minimum. You have to fight for that too. Whereas you're like trying to get like this like princess treatment for the patient, right? Like the maximum. And so there's always like a push and pull with this kind of stuff. When you are referred a patient not through the insurance, so they don't already come with some visits authorized, now you have to contact the company and you have to get this authorization. So you're sending them like the referral and things like that. And typically they will authorize you for like a couple of visits if the patient has that as part of their insurance benefits. And then again, we're back to you do the evaluation, you send them paperwork, and then they authorize you for more. And so you're in this loop until the insurance no longer authorizes additional visits, or until you feel that the patient has met all goals, or whatever, or they transfer out, or they come out of your service one way or another. Or the patient decides that they want to pay cash privately, whatever, for the service, which is also allowable. That's fine. With private insurance, that's okay. With Medicare, typically it's a little weird, Okay. Although if with Medicare you have to discharge because goals have been met and now they want additional services, they could technically hire you privately, like private pay, not through Medicare, but there has to be some kind of extensive documentation about like, oh, they didn't qualify for under the Medicare benefit due to eligibility, blah, blah, blah. It's a whole thing. The third idea that's a little bit different is the billing process. So the billing process of Medicare goes like this. You admit a patient, you bill some kind of thing, whether it's home health or hospice, saying, I'm starting care. So notice of admission or, hospice election, whatever it is, you're billing the start. And that marks your place in the system. And then at certain intervals, you're billing a final claim. So like in home health, you're billing every 30 days and so on, right? Like you're billing at specific time frames, not like a visit is done and now you're billing. A visit is done, now you're billing. So you're just billing like every 30 days, for example, until they're off your service for whatever reason. So the billing with private insurance typically works like this. The visit is done within some number of days from that visit. It varies insurance to insurance company. You need to submit the documentation of that visit along with an invoice to receive payment. If you are late on submitting this documentation, you're not going to get paid. Like, out, done. There might be some insurance companies that treat this a little bit differently, but like from everything I've seen, you can't be late. If you're late, that's it. And sometimes the time frame is like 5 days. With Medicare, we have like a year to bill. Not the initial thing that says I'm taking this patient, but like those final claims, we have kind of more time to build those things, and it'll give you some time to get your paperwork together. Like, of course, with Medicare, all visit documentation needs to be in the office within 7 days. But they do want all the MD orders signed before you bill and things like that. So it might not be like the patient is discharged and like 4 days later you bill everything, right? Like it might take some time to get the MD orders signed, like, the allowable 30 days and so on. So with private insurance, you have like 5 days, maybe 10 days, I don't know, some limited number of days to submit the invoice with the note. Then they are reviewing your documentation to make sure that it's acceptable for payment. So you could go through the authorization process, you could treat the patient properly, you could submit invoice and note on time and still get rejected for the payment. Because like, let's say they deem your note unacceptable or whatever. So if you're going to be working with private insurance, really make sure that you are aware and understand their documentation requirements and what they're looking for. Because it can be very costly if you're late or if you're not filling out the documentation the way they need. And lastly, surveying. So a lot of private insurance companies don't survey. You're just contracted, the contract renews or doesn't, they accept you into network or not, and it's usually more of a credentialing process, meaning like they request some documents, you send those documents, they ask questions, you fill it out on some form, whatever. It's an application process. With some private insurance companies, they will come out and survey you. So when you're thinking about private insurances, I challenge you to think of each one of them as a separate Medicare, because Medicare is also an insurance. It's just not a private insurance. It's a government-funded insurance, but it is an insurance. And so how do we start working with Medicare? We do an application process, then we do a surveying process. Some private insurance companies will require surveying to get in-network and to maintain in-network status. For example, I've seen Kaiser surveying agencies before, and just I think it's going to be like the larger companies, and like Kaiser specifically has like everyone's in network with them. Like I can't work with like any doctor I want, right? Like I need to work with like specific doctors that only work with them or whatever. So, but be aware that there might be some kind of surveying process, which means there's a whole new set of rules that you're required to follow. Now, a lot of the private insurance companies, what they'll do is they'll just say, we go off of Medicare standards. As long as you are Medicare certified, as long as you have a provider number, you kind of already have met all of our criteria. So that's how they get away with like not really quality checking, right? They just go, okay, as long as your Medicare is active, we're good. And so this becomes an interesting thing in California, where once you're licensed in California, you are deemed as active, but like no almost no private insurance will work with you usually. So you really can only work with Medi-Cal, because the private insurances have Medicare participation as a prerequisite to their in-network contracting. So that's it for elements of working with private insurance. I think it's really important to understand this before getting into it, because the mistakes come fast, hard, and expensive. If you're just used to kind of like working with Medicare and the way that goes, and then you're thrown into this private insurance world where everything is like fast, fast, fast. So yeah, please keep this stuff in mind. Again, my name is Mariam Treystman from the Home Health Consultant. And if you like our content, please like, share, and subscribe. Thank you.